Welcome to the Quality Insight video blog. We're glad to have you along on this adventure as we discover the best ways of using Quality Insight to make care better and safer for patients in Saskatchewan. Quality Insight is a presentation of the Saskatchewan Health Quality Council. In this episode, you'll hear a few people from the Patient Safety and Improvement Department in Cypress Health Region describe how they plan to use their regional indicators on Quality Insight.
My name is Greg Grant and I'm the Director of Patient Safety and Improvement for the Cypress Health Region. The regional dashboard will use that within our quality improvement projects to see how they're moving along. So if we implement a program, we'll be able to find out when we look at it as we go along, is the improvement actually making a difference? Is it getting better? Are we meeting? Are we benchmarking? Or are we getting ahead? So we'll be able to follow and have something that's reliable and valid to use.
Cypress Health Region makes quality improvement an integral part of its daily work. Greg Grant explains how they are developing quality improvement capacity and capability across the organization.
A lot of training going on. We had all our senior leadership and out-of-scope directors trained at a higher level, and then they're able to bring that back to their departments and talk about it to teams. For frontline staff, what we do is we begin with a charter that's developed by the senior leader, myself, and the owner of the area, so let's say the pharmacy or the nursing unit, and we figure out that we've got a problem and we outline the problem that needs to be solved, and then rather coming up with a solution, we bring that down to the frontline staff and develop a team of anywhere from 6 to 12 people, and they need to solve the problem. And part of the problem solving is we do just-in-time training, so they get the lean tools that they need to solve the problem. But the solutions that they come up with are their solutions. It's not anyone else's, because they're really the ones affected by the problem. And actually behind here, we have a person, Rami, who is quite involved in the Visual Floors project. And Leona was involved in the start of a 5S project up here that we're still working on. So you can't even move without running into someone who's been involved in a quality project. And the Visual Floors, how did that work out? The crash cart where it was being blocked off by the wheelchairs and the oxygen tanks.
When we started with the room and the filing and the, I can't remember all the lingo that we use, but the cleaning up, I'll say, and then it came to visual. Everything was visual, so then it would be like there was a picture of what we wanted it to look like. This is what it looks like now, and so how are we going to get there? And then took pictures along the way to get there. It wasn't an overnight process by any means, but doing those steps to get there. And then the labeling of everything. We had a shelf that had a bazillion things on there, and you couldn't see what was behind that. So then as we organized that way and had a picture of each item that was on each shelf, then it was easier to organize it. And then to pass that message verbally to everybody, now they know where to go, you know, to get items. It's not so much running and looking, everyone kind of knows where to go now. So.
Yeah. We did just-in-time training right on the floor, like it wasn't in a classroom. We looked at it, brought in the lean tools, and we just got her done, hey?
Measurement is as critical to quality improvement work as diagnostic tests are to proper care and treatment of patients. You can't do one without the other.
Quality Insight Online and the quality improvement could really be built together if we get it using the measurements and the data from that and bringing it down to the team so they can take a look at what's happening. And then when they make an improvement, they can actually we'll be able to go see the changes. If it gets very user-friendly and we get, you know, our technology a little bit higher level, they can even go in there and maybe monitor it on their own, so they could follow it, which would help really build, you know, further put the culture in a lot deeper.
Quality Insight will continue to strive to give the health system the information it needs to improve the quality of care for Saskatchewan citizens.
When I think about the Quality Insight online reporting, I think it's going to be really valuable in the work that we're doing. The tool will be really beneficial for the staff working on those projects to be able to see the improvements that are happening, and I think it'll be really motivating for them to be able to know that that patients are able to access that information as well, and that can be a driving force in wanting to make improvements.